Welcome to The Explainer. Today, we're going to pull back the curtain on laser dermatology. We're going way beyond the Hollywood zap to really get into the sophisticated science that can actually transform skin. A lot of us picture lasers as these magic wands that just erase imperfections. But the reality? They're not magic. They're incredibly precise surgical tools. And really understanding how they work is the key to seeing the incredible results they can get. Okay, so let's get right into it. To really wrap your head around how these devices work, you kind of have to shift your thinking away from just simple destruction. The whole philosophy of modern laser treatment is actually built on three big principles. This right here, this is the core idea. The goal isn't just to blast away unwanted tissue. It's about working with the skin. It's all about using these three concepts to guide your body's own amazing healing processes, but in a really, really specific way. So let's break these down. First up, precision. This means the laser is tuned to hit an exact target, what scientists call a chromophore. Think of it like a smart bomb for specific molecules, whether it's the water in your skin cells, the hemoglobin in blood vessels, or the melanin that makes dark spots. Then there's regeneration. This is where we use the laser to create a super-controlled injury. I know, that sounds scary, but it's actually what kickstarts your skin's incredible natural repair system. And finally, control. This is all about the person operating the laser, dialing in the exact depth, the energy, the density, all to get the result they want without causing any extra damage. It's these three working together that turns a powerful beam of light into a real tool for healing. Now, what's really, really interesting here is that lasers can get this regeneration done through two totally different methods. It is not a one-size-fits-all thing. The whole strategy depends completely on what the goal is. Okay, look, if there's one single concept you take away from this whole explainer, this is it. Understanding these two paths is everything. It's the key to knowing what kind of treatment you're getting and what to expect. So on the left, you've got the top-down approach with a blade of lasers. Think of this like aerating your lawn. It physically pokes these tiny holes, removing columns of tissue from the surface, which forces a massive healing response. Super powerful, but yeah, it means more downtime. Then, on the right, you have the ground-up approach of non-ablative lasers. These just gently heat the deeper layers without ever breaking the skin's surface, stimulating that collagen growth from way down below. It's a much gentler process, and you get little to no recovery time. So top-down for big structural changes, ground-up for more gradual improvement. So let's look at how this plays out in the real world. How would you actually use these principles to fix structural problems in the skin, like deep wrinkles or those really stubborn acne scars? Well, for major issues like deep boxcar scars or just really severe texture, the goal is to physically remodel the skin's architecture. And that demands a really powerful approach, which, you guessed it, leads us straight to that top-down ablative path. And here are the tools of the trade for that exact job. The fractional CO2 laser, that's the heavy hitter. It ablates, which means it literally vaporizes microscopic columns of tissue, while also heating up the area right around it to trigger this huge collagen-building response. The ERYAG laser is a little more precise. It does a similar thing, but with less collateral heat damage, which usually means a slightly shorter downtime. The big takeaway here is that this level of structural change is intense, it's powerful, but it's a trade-off that always involves a pretty significant recovery period. Okay, but what if the problem isn't the skin's texture? What if it's the color? Things like the persistent redness from rosacea or the sunspots that have built up over years. Well, that requires a completely different strategy. This is where that principle of precision really, really shines. Here, the laser isn't targeting the overall structure by going after water. Instead, it's dialed in to selectively find and treat very specific colored molecules, those chromophores, inside the skin. And this is where the technology is just so elegant, it's brilliant. For redness, a pulse dye laser is tuned to the exact wavelength of hemoglobin, that's the red protein in your blood. It zaps and eliminates those tiny problematic blood vessels without hurting the surrounding skin at all. For brown spots, Q-switched lasers are set to target melanin, and they literally shatter the pigment clusters that we see as sunspots or freckles. In both cases, the principle is exactly the same, targeted therapy at its absolute finest. So, we've covered the science, the technology, the what, and the how. But now we have to talk about what is, without a doubt, the most crucial part of this entire equation, because the most advanced laser in the world is only as good and as safe as the person who's actually operating it. This quote from the source material is, well, it's pretty sobering. When things go wrong with lasers, they go very wrong. We're not talking about a cream that didn't work here. We're talking about visible, lasting damage. It just hammers home how high the stakes really are and why expertise is completely non-negotiable. So what does this all mean for you? It means the single most important factor in your treatment isn't the brand name of the machine or the price you're quoted. It is the deep diagnostic knowledge and the technical skill of the professional holding that device. Full stop. And this right here is what you should take away. You can empower yourself by just asking these 3 questions. First, what are we actually targeting here? Is it structure or color? Second, what is the real trade-off between the result I want and the recovery I'll have to go through? And finally, and most importantly, who is my provider and what's their specific experience with my skin and my concern? Because look, understanding the how makes you an informed patient, but making sure the who is qualified, that's what truly protects your skin. So the next time you hear that zap, you'll know exactly what questions you need to ask.